Good afternoon, everyone. Welcome to our second talk in the September Symposium series. Today, we have sexual health clinician Shea Hocaloski speaking for us on sexual well-being and Parkinson's, the male experience. My name is Alana Dillon. I'm an education and support services coordinator at Parkinson's Society BC, and I'll be facilitating our webinar today. Before I introduce Shea, I'd like to go through a few housekeeping items with you. First, I want to let you know that we are recording the presentation portion, but not the question and answer period portion to respect everybody's privacy. So recording will be paused at that time during the Q&A session. The presentation and slides will be available on our website, the presentation recording. Secondly, you will see a chat icon at the bottom of your screen. If you click on that to open it up, you feel free to use this chat box during the webinar to make any comments or questions on today's presentation topic. And just a reminder again, this won't be recorded. So any questions you type there will be not in the recording. And finally, to optimize your experience with this webinar, please ensure that you adjust your speaker volume both on your computer as well as on your actual speaker so that you can hear the webinar well. It's my pleasure to now introduce Shea Hocaloski. Shea Hocaloski graduated from nursing in 2002 from BC Institute of Technology and began working as a rehabilitation nurse at GF Strong Rehabilitation Center in 2003. She joined the Sexual Health Rehabilitation Services and the Vancouver Sperm Retrieval Clinic in 2004 as a sexual health clinician. In the sexual health clinician role, Shea is involved in research, education, and direct client care. She sees clients with various neurological conditions. She has co-authored numerous publications in the area of spinal cord injury and autonomic dysreflexia, perinatal care, and sexual health for persons with spinal cord injury. She has participated in national and international conferences on the topics of sexual health and disabilities. She has a keen interest in assisting clients to optimize their sexual well-being. Shea, thanks for joining us today. I will pass it over to you now. Welcome.
Perfect. Thank you. Hi, everybody. Welcome to today's session. Oops, weird. My slides won't. Okay, I'll have to do it that way then. There we go. Okay, got it. Let's start that again. Hi, everybody, and welcome to today's session. Thank you so much for having me. I know that the topic of sexual health and well-being is something that many people are really interested in learning about, but oftentimes are a little bit shy. And maybe not everybody is comfortable talking about it. So sessions like these are really great to kind of sit back and get some information. So I'm hoping that I'll be able to provide you some great resources today. Basically, today's session is going to be a general overview of what I do and basically how I navigate sexual health concerns for my clients with Parkinson's. And today the focus is going to be on the male experience. So we're going to start off by just introducing the service in which I work with, the Sexual Health Rehabilitation Service. I think it's important to define some of the terms that we often use just to make sure we're all speaking the same language, to discuss some of the important elements in maintaining intimacy and connection in a relationship. I'll also address some common sexual questions and concerns that I see and provide some strategies for managing these concerns and difficulties. So I am part of the Sexual Health Rehabilitation Service. That's quite a mouthful. So sexual health, we kind of call it for short. We're a team of nurses who specialize in the area of sexual health and disability. So I see people with numerous types of neurological difficulties. So that's anything that affects the brain and spinal cord, which includes Parkinson's. So I'm located our service is located both at GF Strong Rehab Center as well as the Blessin Spinal Cord Center. I work mostly at Blessin, which is an outpatient area at the Vancouver Hospital. We are a nurse-run clinic, so We have a physician, a sexual medicine physician who consults to our service, but we do most of the day-to-day education and support. And we also do a lot of collaboration with the community and other community resources and partners. And our service is covered under MSP. So to start out today, I think the best way is to, provide you with a just general definition of what the term sexual health means. So the World Health Organization describes sexual health as the integration of the physical, emotional, intellectual, and social aspects of sexual being in ways that are positively enriching and then enhance personality, communication, and love. So, I've actually started to use the term sexual well-being instead of sexual health, because I think it actually, although it encompasses the definition of sexual health, I think it is more descriptive of what I'm trying to assist my clients to achieve, because it has more of a global view of how we look at a person's life. So as you can see here, I've got this circle that kind of talks about all the factors that influence our sexuality. But we use the term sex and sexuality quite often interchangeably. But I kind of like to break it down a little bit more simply by quoting one of my colleagues. Corey Silverberg is a sexual educator out of Ontario, and he says it quite articulately that sex is what we do and sexuality is who we are. So you can see in this wheel all of these various aspects of our sexuality that are often very interconnected. And there's also a lot of things that can be affected when there is a chronic condition such as Parkinson's. And so it makes it really complex. So since we're human, it's so common to focus a lot on the negative changes, the stuff that, after a diagnosis, things that you can't do, which is really normal, but especially after, initial diagnosis, there's a grieving and loss period. But sometimes people get really stuck there. And one of the most common things that people do, or that I see that people do, are to kind of repeat the same things, expecting different results. So this often creates frustration and disappointment. And sometimes by the time I see people, they're kind of already in this really frustrated cycle. And so, the way we approach things in terms of sexual health rehabilitation is that there are some things that we can't fix, right? There are some things that are part of the disease progression that we can't get back to your baseline before. So we like to look at sexual difficulties through the lens of these principles. And the first one is to optimize your potential. So really highlight the function that you do have. The second is to obviously adapt to your limitations. And that's kind of figuring out new ways to do things to get your needs met. And the third principle we use is to encourage you to remain open-minded. So that's to challenge you to try new things. And really what we see is the more you sort of challenge yourself to try something new, the more opportunities you have to be surprised about the outcome. So, looking at your challenges with these principles can really help us to start discussion on how to move forward with managing these changes to your function in a kind of a global way. So I'm not too sure if you know this, but your brain is actually your biggest sexual organ. It tends to work as the major processing center for all of your thoughts, your perceptions, organization, sensation, movement, speech, so many things you can see here in this really great diagram. This is a visual analogy of using the brain as kind of like an office, and it really highlights how much goes on in this particular organ. So as you know, Parkinson's is a brain disorder. So movement, along with many other of the non-motor symptoms, can impact sexuality. So, I know that how Parkinson's affects you, so I'm not going to launch into all these things now, but what I do want to do is normalize how common sexual health concerns are. I want to highlight that it's possible to have a fulfilling sexual life as long as you're open to talk about your concerns, to challenge some of your beliefs that you have about what sex should be, and to try to look at things and work to try to manage things in a different way. So here is a list of a lot of the common concerns that I see in my practice for people with Parkinson's disease, but really for many people in general. Sometimes, most often actually, people will have more than one concern. because one thing often influences another. So for instance, you may be having erectile difficulties, maybe some decreased genital sensation, which then could make ejaculation difficult. And then there could be some frustrations that sort of arise from that and then cause you to have some lowered sexual interest. So that just kind of shows you that there's also a cascade effect on, it's not always just one sexual concern. Sometimes it bumps into other things. Also, if you're experiencing low drive, this could be as a result of maybe not feeling super confident, or, feeling like your self-esteem is a bit shaken, which can also cause some relationship issues. And then maybe that will also affect the way that you're able to experience pleasure or experience orgasm. So as I mentioned earlier, really in order to assess sexual health, we really need to take a holistic approach here. We need to look at all of the things that are going on for you as a person, not just for how your Parkinson's disease is affecting you. And so we need to look at all of these things. These are some examples of all the areas that we look at to give a full picture on what is contributing to sexual difficulty. So we like to look at, what is your mood? How are you coping? Stress, depression, anxiety can have, an effect. Oftentimes medications or medication side effects, things like antidepressants, can have some sexual side effects that affect how you, your sexual drive, your ability to experience pleasure, as well as erectile difficulties. If there's any strain in your relationship, that's also going to have a little bit of an effect, or a lot of effect, depending on your relationship status. How you feel about yourself, other medical conditions. So if you have something like diabetes or high blood pressure, that can affect your vessels, which make you more at risk for erectile difficulties. Also, hormones, right? So hormones such as testosterone, as we age, can decrease, just as a general sign of aging, but also it can be for a number of other reasons. Maybe you snore. Maybe there are some medications that are having an effect. So we also need to look at that, how your bowel and bladder is being managed, if there's any incontinence or urgency or frequency that can affect sort of how you feel about yourself, if you're experiencing any pain or fatigue, and certainly, just the general physical changes. So mobility challenges, some tremors, sensation, facial masking, memory, cognition, all of that can also have an effect. So I know you probably know this if you're experiencing it, but it just started to show you that when we're looking at sexual well-being, there's so many factors that we need to look at in order to assess the whole picture, because it isn't just about looking at what's going on in the genitals. It's oftentimes what's going on for you as a person in so many other aspects of your life. So looking at things like pain reduction strategies, energy conservation, timing activity to medications, confidence building strategies, positioning options, or looking at sexual devices, depending on your level of comfort, right? Referrals for further evaluation for bowel and bladder changes, relationship counseling, or even like some just blood work to test hormones or other or look for other medical conditions can be done. So there's a lot of layers when we're assessing your sexual health and sexual well-being. So I think it's really important when we're talking about sexual well-being to talk about the importance of maintaining intimacy and connection. So this is for clients who are in a relationship. Intimacy is so much more than just the activity of sex or sexual intercourse. There is a huge emotional component that's also part of this. And what I tend to see is that oftentimes when aspects of physical intimacy, when there's a difficulty, so let's say there's erectile dysfunction, oftentimes all the other things that are physical intimacy, like kissing and cuddling, a little pat on the bum in the kitchen, or all those things that kind of you would show affection towards your partner, sometimes those things kind of start to get affected because there's this idea that perhaps, some of those things used to be done as kind of a signal that you're wanting to be intimate later that day or later that evening. And when there's a difficulty, sometimes there's this thinking that if I do some of those things, then maybe they're going to think I want to have sex, and maybe I'm not quite ready for that. And so you kind of just stop doing that altogether. And then when you stop kind of that tuning in terms of, being affectionate, oftentimes the emotional part of intimacy also can be disrupted. So that's that whole idea of, talking about what's going on, being really open about, what's changing, being really, just sort of being there. And what you end up doing is you end up actually sort of retreating a bit. And so that can really lead to feelings of loneliness and isolation in a couple, because all the things that kind of keep you connected sort of start to fizzle away, especially when, the physical touch and the talking kind of goes away. So when these changes have occurred or are occurring, it's really, really important to maintain communication. And that can start by just talking about what's going on. So talking really openly about, the fears of the changing function and the feelings that kind of go along with that. Oftentimes there's some shame and some frustration and worry and about what that means for the relationship going forward. And so it's really important to kind of keep that going and talk about it. I do understand that oftentimes, this is a topic that couples, even though they do it, don't always talk about. And so to start that process and maybe even use something like this talk today as a catalyst to be able to start the conversation, to be like, hey, I went to a talk today and it really made me think about us, and maybe we can have a conversation. And it might feel a little bit strange, but it's so important. I also want to mention that sometimes, with sleep disturbances and stuff, couples start to sleep apart, and that also can disrupt opportunities for just general touch and cuddling at night, which can kind of bring things further apart. So I already mentioned that intimacy can be enhanced through communication. I also want to talk about caregiver burnout. So it's so easy when you're living with somebody who needs some help. So this is for your partners, that they kind of give up a lot of things for themselves. And so it's really important to try to create some space and take some time away so that there is that ability to be really present and maybe not be resentful about the caregiver role, because it's really difficult to flip on and off the switch of being a caregiver and a lover. And so sometimes that can be really exhausting for clients or for clients' partners. So I just sort of wanted to put that out there, that, caregiver burnout is something that is really real, and it's really important to try to find some strategies to be able to take a bit of a break. Is there some caretaking tasks that can be delegated to someone else, like friends or family, or even some paid caregivers? Maybe even re-examining what the new roles and responsibilities are and seeing if things can be divided in a different way. Are caregivers doing more than is necessary for them to do? Also to kind of look at maybe how this role is impacting interactions with your partner, how it's impacting interactions for you guys as a couple. And then, taking care of yourself is a way of, putting more gas in the tank so that you can give more and do that, in a way where there isn't as much resentment built up. That said, I think it's also really important to look at sort of the idea of grief and managing grief and loss, especially when there is some declining function. So there are a lot of changes that occur with Parkinson's, right? A lot of non-motor symptoms, cognitive dysfunction, hallucinations, depression, anxiety, restless legs, hypersalivation. All of these things can kind of change how each partner sees either themselves or each other. And when there's change, there can also be a lot of feelings of grief and identity loss. So there is like a interconnection and a intersection with all of these concepts, because one can be the cause and effect of the other. So we do know that, like I said, changes causes grief. And so to help for the person with Parkinson's, I think to help manage your feelings of grief with things in terms of functional loss, you need to kind of recognize those feelings and be able to start to recognize them and maybe talk about them and try to access some supports, such as counseling. And then for the couple, I think it's really important to meet each other where you are now, to support each other, to try new things together, try not to get stuck in the past, cherish old memories while striving to make new ones, look for qualities that you love in each other every day. And that can be aside from the caretaking role in the Parkinson's disease symptoms. Realize that you both have changed from your experiences, and that life basically always changes, and try to find peace in that some way. And then, really, again, being open to try new things. So I really like this quote by Esther Perel saying, "Adaptability in couples is about responding to life's changing circumstances with good communication and a lot of flexibility." And so she's also come up with some questions, which I think are really great to help couples build this adaptability quality for themselves in their relationship. So things like questions to ask each other, or what will help us survive and thrive during this transition? What do we want to take with us from our previous relationship stage into our next one? What do we want to leave behind? What do we want to try that we have never tried before? What does it mean to consciously move forward in this new relationship stage together? What conversations need to be had? What affirmations need to be given? How can we redistribute our resources? And what do we do when we're finding it difficult to adapt? And how do we remind each other that we're in this together? And I think that's a really important piece, is that when couples work as a team and are able to communicate about what's going on, it's much more easy to be adaptable and to thrive in the relationship. So I don't want to miss anybody here in this talk. That, I don't want to assume that everybody that's attending here today is in a relationship. And so, maybe dating is something that has crossed your mind, or something that you might be a bit hesitant to do because of fear. But I think that, dating is for all ages, and there are so many resources available for you now online. It may be overwhelming, but I think it's really important that if companionship is something that you're looking for, then it is something that you can put yourself out and do if you're ready. So, I really say don't go down this road if you're not ready to. Perhaps, start more simply by finding opportunities to socialize and practice to getting to know people and ask questions without that pressure of finding a partner or a long-term mate. And this activity can even help you prepare to kind of get into that arena if you want to help build your confidence. So, here we can use technology to our advantage, right? Online dating is something we've had 2 years of COVID. So I'm assuming people are getting used to, like you're here today on Zoom. So, doing this online can really help with some, making some connections. And so, there's so many dating sites available. I think, the idea of making a profile and being really real and honest about, about yourself, I think is a really great way of weeding out people. Also giving people information so that they're not, when they show up to meet you the first time, they're not kind of like a little bit stunned or don't know what to do when you kind of disclose your chronic condition. And so, so I, if that's something that you're keen on doing, I suggest, being open about your profile. Also taking time to know yourself, to really, take some time to think about what your hobbies are, what are your interests, so you have things to talk about with another person. It's also important to build your resilience, so prepare for the dating world isn't always lovely. So prepare for rejection, and also to maybe, if something isn't going well, to be able to have those conversations about not pursuing somebody. And so there, comes a time where we need to look at maintaining a sense of humor in this, because, there are going to be times that are complete fails, and you have two ways of looking at it. One is, to be completely devastated that something didn't turn out, or to have a bit of sense of humor to say, well, that was kind of silly and really out of my element, or that person was really not for me, and kind of to laugh about it and have some humor. So that's dating, but I also don't want to limit it to dating. And so, maybe you're not really there yet, but sex doesn't have to be, and sexual well-being doesn't have to be only with a partner. And so the next slide shows some devices. So I just want to warn you, but if you're not in a relationship, then being sexual with yourself is an option, right? So sexual pleasure doesn't have to be dependent on the presence of a partner. That, sexual stimulation is easy and safe way to manage your needs. And I understand that not everybody will be comfortable with, looking at devices, maybe not even know where to get them. But they can be quite helpful, especially when fine motor dexterity changes. So using your own hands might not be as easy. And so I pictured a few things here. Some have, like the Tenga Flip has some vibration built in. Others have, different textures built in that can, if there's any decreased sensation, that can help with that. And so, yeah, it's kind of to put it out there that this is something that's quite common and encouraged. And, you may not be 100% comfortable or even know where to access these things, but the good old internet is really great. That's why I put the names of these items on there, so that you could, Google if you want to take a picture or anything of these. I also want to take a moment before we kind of launch into, what to do about the sexual difficulties. I wanted to just point out that it's important to discuss that compulsive sexual behaviors can be something that is present in Parkinson's disease, mostly related to medications. There's also other compulsive behavior, so just compulsive eating and gambling, that can be part of it. It's also something that can be quite distressing. So quite distressing for family and for the person. It's not really well understood, but like I said, it might be more of a reaction to the dopamine agonist medications such as levodopa. Due to the nature of these behaviors, so the associated shame and embarrassment, it is likely that the prevalence rates may be underreported. I think the literature currently reports that it's about 3.5%, a really low number of people with Parkinson's disease that do experience this. But I think, like I said, it might be underreported just based on the nature of the topic. So I want to just put out there, if it's something that you're dealing with or something that your partner is dealing with, that the best thing to do is to talk to your doctors. Early detection and management is really, really important to limit the distress and burden that these behaviors can cause, because it's really not about the person. It's a behavior based on a reaction of medication. And so if you're able to address it early, then you can kind of move on past it. So for the next few slides, I want to talk about, how to, tips for optimizing your sexual well-being, right? One of the main things we see is, changes to confidence and self-esteem. That, with all these changing things, with the progression of the disease, it can get really frustrating, kind of feel really, really low on yourself. But I want to point out that you are more than just your body, right? Try to focus on maybe not dwelling on limitations, but instead start to learn to identify qualities that you appreciate in yourself. Things like daily affirmations can be quite helpful. Statements that I am kind, I am strong, I believe in myself, I accept myself. They can be really helpful to kind of repeat so that you can kind of build back the confidence. A gratitude journal about things that are positive aspects in your life, lists of things that you're grateful for, or maybe things that you accomplished day to day. Looking people in the eye when you're walking down the street, or walking or wheeling down the street, and saying hello, just making that effort to look at people can also help to improve your confidence. In terms of the sexual part of things, I think, again, going back to that communication. So communicating with your partner what's going on, your fears about this area, what you would like, what your sexual needs are, what you would like, and then you can work together and really focus on being present and curious and playful. This is really supposed to be fun, right? So I know that I already said this, but it's worth repeating that your brain is your biggest sexual organ. So sex works best when you don't have to think about it. But when there's difficulty, it can, it can basically snowball, right? You start to feel frustrated, and that can kind of catapult into bigger thinking, catastrophizing thoughts. And that can have a huge impact. That's where your mood comes in, right? That if your mood is feeling depressed or anxious, that's going to have a negative effect on this thing here that's going to sort of make you not really feel all that sexy. And there are so many contributing factors to your sexual drive that impact your brain, right? So there can be the relationship factors, your mood, feelings of frustration, any changes. If you keep feeling frustrated, your motivation for wanting to keep having that feeling goes down. If the sexual payback is low, so if you're not able to achieve, feeling the same way, again, that leads into frustration and maybe some anger and sadness. And then that can also kind of catapult in a negative way. But also we need to look at hormones. And I think I mentioned that earlier, is that testosterone is a hormone that in males just generally goes down with age, but it also can go down if you snore. So if you snore and have sleep apnea, if you use medications like pain medications, opioid medications, that can make things go down. If you had a history of concussions or that's it, the aging process. And so, looking at what your energy levels are, how are you sleeping, and what is your interest, maybe it's worthwhile having your testosterone levels be assessed. Because if your testosterone level isn't at a optimal level, then sometimes it makes some of the medications that I'm going to talk about in a minute not work as well. Also, desire comes in two ways: spontaneous desire and responsive desire. And I think the media portrays spontaneous desire so much more, that it's this idea that you just have this all of a sudden, this feeling of like wanting to be sexual kind of hits you. But that does dissipate in a long-term relationship, that does dissipate with age. And it tends to be more of this responsive desire where you're not really thinking about, being sexual, but if there is an advance, then you can respond, your body can respond, and you feel desire when you start to be sexual. And so I want to highlight that, this idea of the spontaneous desire does go down. And, most people don't experience it. They experience more of the responsive desire. And also for sexual payback, to time activities when medication are most active and your energy levels are better. So if you're feeling more energized and you have a better experience, it's going to be more motivation to want to do this again, right? So mindfulness is also something that I've looked at as a strategy for improving sexual well-being and sexual interest, because it is really a practice that allows you to be really mindful. So you can see the diagram here. When your mind is really busy with a lot of thoughts and worries, it really makes it difficult to concentrate on the present. And so this is a practice where you start to become really aware of moment to moment to moment. So not focusing on what's just happened or what's going to happen, but you're really just present. So mindfulness is a quality that we all have, but it's something that you need to work on. It's something you need to conjure up. Our brains can kind of be like puppies, right? Looking at a squirrel, we can get easily distracted. And so it's a practice of really focusing our attention for a short amount of time and to be in our body and really present. And I think it's something that, some people will roll their eyes at me, most people do, to say like, oh, I'm really not into this kind of stuff. But there are so many ways that it can be helpful, not just in the sexual health area, but also just for your concentration, for your mood. So it's used in depression and anxiety. It's also used to treat like chronic pain. So there's lots of different areas in which this technique can be helpful, but we found it to be quite helpful too in reconnecting with your body and kind of getting out of your head and more into being present with the sensations that are going on. So I kind of just reviewed all that, but we can learn by doing these techniques. We can learn new areas of our body, maybe improve the mind and body connection. Over time, perhaps it can help us feel better about ourselves and the way we view ourselves. It can improve focus and attention. And I know these days with things like cell phones, it's very easy, and Netflix and stuff, is really easy to be sort of mindless and to be really have a difficult time holding attention. So this is something that can kind of help you get that back. As I mentioned, it's good for pain management, stress reduction. And I think the highlight of this is the self-compassion and, overall maybe helping with just a general quality of life. So, this is probably what everybody has been waiting for, is talk about, okay, let's talk about erections and what are all the options for me in terms of looking at how to improve my erectile function. So there are a lot of options to explore. We always look at the least invasive first, and that's things like medications. They're called PDE5 inhibitor medications, but you probably know them most likely on the market through the commercials as Viagra, Levitra, or Cialis. So Viagra and Levitra are shorter acting medications. So they're in the system for about, or active in the system for about 4 hours. And then Cialis comes in a longer acting, so one that's there and ready for you to use for 12 hours. They call it the weekender in France for that particular reason. And there's also a daily 5 milligram option as well. But I do want to point out that for Parkinson's, because there is often a slower GI function, that these medications may take longer to take effect. So instead of taking the 30 to 40 minutes that are recommended in the package, sometimes you might need to take up to 2 hours for it to take effect. And so a lot of people that I speak to say, oh, I tried it and it didn't really work. When I ask them to go back and try it again, but give it longer time. And so sometimes that in itself can be helpful. There's also things like intracavernosal injections. So this is a injection that goes directly into the penis. This is something that was on the market long before the medications were. It's a much more affordable option if it can be potentially covered through a special authority request, and it costs quite a bit less than the medications. But it is invasive, right? So it is putting a small insulin needle into the penis. And it can be one medication or a combination of medication, but it can be quite effective, and it doesn't really necessarily require the arousal for it to work like the medications do. So the medications like the Viagra and Levitra and Cialis, there needs to be arousal for it to take effect. So you can't just sit and watch TV and wait for it to happen. You actually have to do something. So you have to touch the penis, or you have to be aroused in your brain. The intracavernosal injections, there has to be some touch, but it's not as dependent on that. There's also options as vacuum devices. So that uses like a suction to pump up to create or to pull the blood into the penis. And it can be used with a constrictor band to kind of trap the blood in there. You have to be really careful with that. If you go too vigorous, it can cause some bruising, or using the bands, it can only be on for about 30 minutes. Otherwise, there isn't a lot of oxygen exchange. And so just like if you were to put an elastic band on your finger, it will go blue if you do that on your finger. We just don't want, if it's on there for longer than 30 minutes, it can cause some further vessel damage, which we don't want to have happen. We often will, if the erections are really difficult and they're not working with any one particular option, oftentimes we will work with a combination of therapies. So maybe the vacuum device with a medication, but that's something that we would suggest you would have to work with your doctor or healthcare professional with. I wouldn't recommend you go trying all of these things all at once on your own. And in some of the literature, there has been some discussion about the use of apomorphine. So apomorphine is a medication that is used for Parkinson's disease. And I think at higher levels, they were noted to have maybe some positive effect on erections. But it isn't something that we use in our practice here. And it sounds like in doing a little bit more research, there is some side effects with nausea and stuff that may not be ideal. And so I put it out there because there might be some questions about it. It is in some literature, but it isn't something that we often recommend. So sometimes ejaculation and orgasm can be difficult to experience. This can happen, as the aging process occurs, or also if there is any decreased sensation in the penis. But I want to point out that orgasm and ejaculation actually, even though they happen together, they are two different functions. So orgasm is basically the brain's interpretation of a release, a physical release. And so the two function often together, but they are separate. So you are able to have an orgasm without the ejaculation reflex happening. So some men have a hard time kind of getting that sorted out in their brain because it's never been the case for them. And so that doesn't make sense. But orgasm can happen without ejaculation. And so with that in mind, I think people can get really hung up and focused on, well, to try to make ejaculation happen. And so then kind of get really, really narrow view about the outcome. And so here's where I suggest that perhaps shifting the focus to sort of what sensations, what type of stimulation creates pleasure. And if you focus on just experiencing pleasure, and work with that, then oftentimes you can get to the point, maybe not the same orgasm as you had before, but something perhaps pretty close, or just feeling good. So things like the use of massagers or vibrators can also be really helpful to increase stimulation. And I also want to normalize that as men age, the seminal volume does decrease. And a lot of men don't know that. So, they're used to seeing a lot of volume, and over the years that does decrease. So that is a normal part of aging. So also positioning. So with, stiffness, rigidity, tremors, sometimes finding a comfortable position might be a challenge. And so I suggest, using household items such as pillows and headboards and chairs, maybe up against a wall for stability, that can be quite helpful, because it's really important to be comfortable to enhance the experience, right? Discomfort can be a distraction, which can really get in the way of the focus on pleasure. And also using pillows and other supportive devices can help with your, not only just stability, but also for supporting your joints. And then again, just to remind you to, try to plan activity when your medication is in effect. So we've gone through, I feel like I whipped through so much information today. And I just wanted to summarize a few key points. Basically, sex works best when you don't have to think about it. You just do it. But oftentimes to prepare for that, you need a lot of communication. So to talk about your needs, your wants, what you're looking for, what your overall goal is. And most of the time that is just some form of connection. If you're able to communicate your needs, if you are able to use some of the techniques like the mindfulness, the medications or sexual devices that I talked about today to enhance your sexual response, if you are open to trying things new and you're able to focus on pleasure and outcome, then I think you're going to be well on your way. But sometimes it's really difficult to do that just on your own. So I'm hoping that the information provided today will give you some things to think about and ways you may want to kind of approach it going forward. So talking to someone, talking to your family doctor, talking to a counselor, talking to anybody about that, or requesting a referral to our service. where I can help. It's much easier individually to talk about what's going on and tailor some suggestions specifically for you. So here's some information I'll leave you with on how to be referred to our service. So you can take a picture of this or screenshot it, or quickly, the next slide will have my contact information on. So your primary provider can refer you to us. If you don't have one, and I know that it's really difficult to find a provider these days, that feel free to contact me. You can email me or give me a call, and we can try to work something out. So if you're struggling, I think the best thing is to have some support, and I'm happy to work through that with you. So that's a lot, and I think we're ready to stop the recording and go to answering some questions.